intro for folks. All right, everybody, thank you again for your patience. And if you're just joining us now, appreciate it. We had a little bit of technical difficulties at the beginning of our webinar, but now we are back on set. So I just want to welcome everybody once again to the Ask the Expert Skin Cancer Awareness featuring the American Cancer Society. We are joined today by Michelle Hicks Turner, who has so far shared a lot of great information with us. But I just want to point out that, it is alongside Women's Health Month. It is also Skin Cancer Awareness Month. One of the most common form of cancer is diagnosed globally. And Michelle was deep in the middle of telling us about kind of its effects on the skin, what melanoma skin cancer looks like, and also its frequency among different pigmented skin tones. So Michelle, I'll go ahead and I'll turn it back over to you for the remainder of our presentation.
All right, thank you. Thank you, Dakota. So this is the melanoma skin cancer type. So it's less common. This is the one being responsible for nearly all the deaths related to skin cancer. And so you can see here, this is why it's in that. It's right below the epidermis level here when we think about the 3 levels of the skin here. So this is where the reported new cases of melanoma are on the rise. With early detection, melanomas are easy to treat, less likely to spread, and can sometimes start in places that are hard to spot. So it could be, and I believe I have a slide here. Yes. So you have it here. This is an image of the heel of someone's foot, believe it or not. Different colors, jagged borders. They may be round. You see here in the second picture, they may have like this trunk, or they said trunk, many legs over here, most likely start in certain locations like the neck, the face. I'm not sure where the second picture is from, but this is what they look like for the melanomas here, if you've ever seen anyone that has melanoma. And then also too, feel free to visit cancer.org, or you can scan this QR code if you want to see more images, preferably not during lunchtime if you have a strong tummy, of melanoma skin cancer. You can visit that there. So what causes the skin cancer? One is that sun exposure leads to skin damage. So most of these skin cancers are caused by repeated and unprotected exposure to ultraviolet UV radiation, which can change the genetic material in your DNA and other cells, among other problems. So you have it there, the DNA damage that goes at the epidermis level, the first level, which is the UVA, UVB rays, which greatly increases your chance for skin cancer. And then when you get the dark patches, the wrinkles, loose skin, premature aging, all of this breaks down eye problems when you get here at this level here as the sun, and you have the sun rays and then how it's going to the skin surface here. So there's general risk factors that for skin cancer that I want to share with you, that anyone can, like I said, anyone can get skin cancer because everyone has skin. But some people are at higher risk. We like to think of, average risk, high risk. So people with natural blonde hair or redheads, they tend to have a high risk of having skin cancer just because of their DNA and their genetic. Or people that take medications that make you sensitive to light. Sometimes if you're on hypertension medication, sometimes that can make you ultra sensitive to sunlight, UV. And so you may need to wear a different skin protective on your skin than a regular skin block. People with freckles, I mentioned the fair skinned, spend a lot of time outdoors. Think about summer's coming up, your beach volleyball, basketball, swimming, even pickleball. These conditions, they definitely increase your exposure to sun, but you have a condition that lowers your immune system, you have had skin cancer before, or you have a family history of skin cancer, especially the melanoma. You live and travel to tropical climates or high altitudes, or, which I love this site here, I actually have some moles too that is just genetics, but have a lot of moles on large irregular shaped moles. You can go on cancer.org/moles to check out and see, is this mole just a regular mole or is it melanoma? So we talked about basal and squamous cell skin cancer have common risk factors. One, unfortunately, aging. I even say that unfortunately, but there's some things that come with aging: prior skin cancer, cirrhosis treatment, smoking, HPV infection. But you know that for those here on the call that have children between ages of 9 and 13, they can have an HPV vaccination. And then you have long-term or severe skin inflammation or injury, a weakened immune system, people with lupus. For example, prior radiation treatment, usually our pediatric children or childhood cancers and they've had radiation at a young age, that puts you at risk as well. And then your gender, exposure, and then rare inherited skin conditions. So melanomas, let me move this here. Maybe I should turn here. Well, I'm looking at my second screen, you all, sorry. But this one here, sorry. Well, melanomas have some unique risk factors. So it's, again, the weakened immune system, the gender, the age, check your moles, rare inherited skin condition. If you have psoriasis, I'm blocking this one, personal history of melanoma and your family history. And then also, I just put in the chat that also on the slide here, 10% of people with melanoma have a family member with melanoma. And that's why behind me, my team's background is we have ACS cancer risk assessment. You can take that on cancer.org as well, and you can find out and discover what your risk factors are, because it does ask you a lot of questions about your family history. Just had to give a shameless plug there. How can you prevent skin cancer? One, avoid the UV exposure. Even though we love the sunlight, especially being from the Midwest like we are, seek the shade. Aim for outdoor activities in shaded areas between 10 a.m. and 4 p.m. But if you like me and you like the beach, you know, I have a beautiful sun hat that I have, and I wear my sunscreen and I wear my sunglasses. So you just protect yourself, and then limit yourself to the sunshine as much as we love it. Know your number. All SPF is not created the same, or even know what the UV index is. It's good that we have that information on our phones. When you listen to the weather, they usually tell you what the UV index is for the day. And then if you know the number, then you know that, it's high today. I better make sure that I put on my sunscreen and put on a hat today, or, take some time to hang out in the shade. Avoid UV tanning beds. They're definitely more likely to have skin cancer if you participate in that. And then most importantly, protect your children from the skin. Children spend a lot of time outside. You definitely, sorry, I'm blocking this again. Their skin is so, remember, age is something that as you get older, you get it, but then think about how tender the children's skin is. So you want to protect them. You put their hats on and reapply your sunscreen as much as often. At least an hour, like after an hour, you may need to reapply it again, because you just can't put it on one day and then be done with it. You have to reapply it, especially depending on how long you're going to be out in the sun. So yeah, here we go. Use this broad spectrum sunscreen with at least SPF 30. If you need a little bit more, like I said, based on your medications, you may need a different type of SPF, but that's a conversation that you would have with your doctor. But apply, I said an hour, but every 20 to 30 minutes before going outside, and reapply every 3 hours. So I said an hour, but every 3 hours if you're definitely out in high sun. You're doing that. And then limit sun exposure even if you use sunscreen. So like I said, we have a lot of, which I think my next slide is going to go into protecting your skin with clothing. There's a lot of SPF clothing out there right now, which I have a bathing suit that's SPF, and I also have a shirt too. So you can wear clothes to cover your skin. You can wear a nice, beautiful hat, and then wear your great sunglasses. But make sure you look for the UVA and the UVB rays protection in your sunglasses. Not all sunglasses are created equal, for sure. Last one, talk about getting to know your skin. Main thing is having a conversation with your doctor, and don't be surprised that if your family practice or your internal medicine, they may not always check your skin depending on what time, when, the season that you're going to see your doctor, but be aware of it. That's why I say be familiar with your skin. If you notice, as you were looking at your skin, that there's a mole, and you're like, this mole looks different, or it's getting bigger, I don't know what this spot is, this is a good opportunity to have that conversation with your doctor. Or you need to make an appointment with a dermatologist because they will go on a um, deeper exam of your skin versus your regular PCP doctor. And then we talk about knowing being able to pick out any changes, perform an optimal environment. So when you look at your skin, don't do it at night. You know, you must make sure you have a well-lit room, full-length mirror. And if you have a partner, someone can check your skin, like look at this. Hey, I noticed that mole on your back. And even check between your toes, because sometimes the melanoma hides between there. And then examine all areas, including your palms, your soles, your scalp, your ears, your nails, and back. And then and I'm covering this up again. Sorry about that. Regularly, usually check in once a month. You can do your own skin checks. So again, like I talked about with you looking at any new growth or moles, spot or bump that's getting bigger over time, the shape of it is changing, the feel or color or sore that doesn't heal within a few weeks. You definitely want to be aware of that. And so when you're going to your doctor, or you can even take a picture of it to make sure to say, hey, I'm concerned about this. What do I need to do? And then from there, usually your doctor, your primary care doctor will look at it and then maybe make a referral to a dermatologist. And then like I talked about moles, I have moles. Most people do. Colored brown, tan, or black spot. It can be either flat or raised, round or oval. Generally about 1/4 inch across. And it can appear on the skin at the same time, especially if you're being exposed to the sun. And it usually stays the same size. It doesn't change over the time. And unfortunately, my moles haven't faded over time. But a few have. I had one mole on my finger and it faded over time. But most of them don't. They're still there. Finding skin cancer early. So we have a little tip that we have from the ACS that we like to use called the ABCs of melanoma. A, is it asymmetrical? Half the mole does not match the other. That's what you're looking at. And then you want to check the borders of these moles. Are they regular? Are they ragged? Are they blurred? Are they notched? And then the color, look at it. Is it changing colors? Is it black? Is it brown? And again, this is going to look different based on your skin tone, but you want to look at the color, the variations of it, any changes of it. Is the diameter, is it getting bigger? Or is it raised, evolving? All of that you want to look at. So that's ABCs, D, for melanoma. So you can check that as you're doing you're doing your self checks for skin cancer. And then this is another one. What do you notice? And you all, and I can't see the chat, and Dakota, you can maybe tell me, like, what do you notice about these screenshots of moles or discolorations on people's skin? Do you notice anything different? Let me see if I can move this over here and put this here.
Abnormal shapes.
Yeah. Yeah, definitely the third one here, it has when we talk about that pearling, that purple. So that's definitely the coloration here is different. The middle one is different too. And then you can see the diameter, how this one, there's something going on the side of this mole here as well. So you can see as it changes in there, that's why we like, it's going to look different, right, on different people. And then we have example of different skin tones. So I really highly recommend you all, if you really want to get into or see more pictures of what melanoma looks like, you can check that out on cancer.org. So good, the asymmetrical here. You see it with this mole here. You see the different colors of it. You see it is growing more on this side of it. And then the diameter, and this has changed because you can see with this slight pink part that it's getting, it will eventually get bigger and spread. So again, cancer.org, scan the QR code if you want to look at more images of skin cancer. You all did pretty good in looking at the changes of it. So last and certainly not least, and I'm open up to questions, but if you can scan again our QR code, if you want to know more about skin cancer, you can go on cancer.org. You can also call our cancer specialist 24 hours a day at that 1-800 number, 227-2345. And that concludes my PowerPoint presentation. Or if there are any questions for me, and I'll stop sharing so I can see.
Yeah. So one of the questions that like I had, so a vitamin D deficiency is very
Mhm.
common, especially those in the continental United States. So what advice do you have for folks in kind of balancing that, right? Because vitamin D is,
Mhm.
from the sun, that's a great source. So how would you go about finding the balance between like that healthy sun exposure, right, and then limiting that sun exposure, like you had mentioned earlier?
Right. So I would start with Dakota, making sure that you go to your doctor so you know what your vitamin D level is. I know when I go, like you said, living in the Midwest, most people vitamin D levels are low, but then some people their levels are lower than average people. So I would go to the doctor and tell them, ask them when you're doing your overall checkup and say, can you check my vitamin D levels? Especially if you're going to your doctor in the winter and the spring, and based on your vitamin D levels, they will prescribe you a vitamin D supplement that you can take based on where your levels are. But you can still get the vitamin D from the sun because even though you're outside, you're having your sun protection, you'll get some of it. And then you can get it from naturally through the sun, or you can take supplements through vitamins. But I would really recommend that you talk to your doctor because you can overdo vitamin D, and vitamin D needs to be coupled with sometimes with calcium and things like that. So you got to make sure you have the right level for what you need. So I would suggest you go back to your doctor. And if you're concerned with being vitamin D deficient, because sometimes the symptoms, I've been vitamin D deficient before a couple of times in my life, and I didn't really have any real symptoms. I said I was tired, but that can be related to a lot of different things. Can be concerns
Right.
in our life, right? But when she
Yeah.
checked my levels, she's like, your vitamin D level's low. And that's when she prescribed vitamin D subscription. But you can still go out in in the sun, or we just want you to protect yourself. But thank you for your question.
Yeah, I know, because I know that again, vitamin D is something that, I mean, I'm deficient in vitamin D, and most
Mhm.
people are. And like you say, you don't even realize it because what it could be attributed to a lot of different things, right? But yeah, thank you for answering that because I know that I always heard that like just go stand in the sun. My parents were like, you need some vitamin D, go out in the sun. But also I was a kid who played video games in the basement the whole time.
Oh yeah.
Um, so looks like we have another question here from the chat here. What are the steps to take if you find out that you do have skin cancer?
Well, of course, I'm going to say go to cancer.org because we have some resources on, okay, you have melanoma. What do you need to do next? Of course, your doctor will tell you that, unfortunate news, and then they're going to prescribe a plan for you. But what I like about the American Cancer Society, what we do have are the resources. So you have melanoma, depending upon the stage, they will have your pathology, would have to give you a stage. Are you stage 1, stage 2, stage 3? At different stages, it may mean they may take some of that, operate on the mole, remove the mole, and then you may have a series of chemotherapy or radiation. It's all going to depend on your staging. So that's when you have skin cancer, your doctor will tell you that the next step is you're going to see an oncologist. And from there, you'll receive your treatment plan. But always know that the ACS, we do have resources that we can have for you to support you. We have questions to ask your doctor. Even when you ask the oncology, these are the questions you can have. We have questions for a caregiver if you have a caregiver that's coming with you, so support for you as well.
Awesome. And then another question that just came in. Can you talk more about the differences between melanomas and basal cell carcinoma?
Yeah, melanomas are the ones that definitely cause skin cancer. They're the ones that can metastasize, it can spread to different parts of the body. But your basal cell carcinomas they don't go as deep. And when you think about those three levels of the skin level, so they may stay at the epidermis level and they don't go as deep. They can be removed, but unfortunately, they'll come back. But they usually don't spread into like different stages and I mean if they're caught early. So that's the main difference. Melanomas are, if you find it early, because that's the part where when we think about the mortality rate can be higher for those with melanoma because they don't know that they have melanoma because they think it's just a mole that got bad or infected. And so by the time they realize it, they're at late stage. But the basal cell, like I mean, my Hugh Jackman example, he has it. Unfortunately, he has a recurrence of it. Maybe it's a family history, I'm not sure. But he'll have to keep going to his dermatologist and his oncologist, and they'll keep removing it. And he has to be mindful of it and probably have a really high SPF sunscreen what he uses, and beware and watch out for the sun. Even though he's Australian, but hey, he has to protect himself now more than ever. But that's the main difference. I hope that answered your question with the melanomas and the basal cell carcinoma. Melanoma is the most deadliest one because that's straight on cancer. Oh,
What is your favorite sunscreen?
um, personally, what I like Black Girl Magic, and reason why, because I'm a melanated person and I have a lot of, yeah, as you can see here. So I noticed with some sunscreen, it leaves a white cast on my skin. So I noticed with Black Girl Magic, with my skin tone, that works better for me, and it's just a 30 SPF. I like Neutrogena as well, and then there's also some good tinted sunscreens. So if you have darker skin, that will probably be better for you without having that cast on it. Because that comes with the face. When I put on my face, I also put SPF every day, even in the wintertime, even on a cloudy day, because you still have UV rays that's come through. So I like the Black Girl Magic just because I don't like the casting on my complected skin. But thank you. That's a good question. Oh yeah.
And where are you able to get that? Drugstore, online?
Yeah, you can go online. I get mine from Target. So, and they have all kind. They have lip gloss. I wear that as well. Because I believe you should have lip balm. Your lip balm should be SPF as well. Usually lip balms is about 5 or 10 for SPF protection. But yes, I like that.
Now, are there any spots or places where like seeing those type of like occurrences are common? So like ears, noses,
Mhm.
like I mean, obviously, I think it depends on like level of exposure, but given that skin cancer is so common, are there any spots that like this is a good spot to check first?
Yeah, I will obviously the big one, like you mentioned, your neck, your face. But check between your toes. I have a cousin lives in New Jersey. He's about the complexion of you, Dakota, and he had skin cancer, and so he found the skin cancer. The mole was between his toes. That's why I said check between the toes, and that was just an odd place to. He just like I was like happened to look, and I was like, what is that? And that's and he found out he was after getting checked that that's what it was, but. I would check those areas, especially if you are in the sun a lot and you don't wear a lot of sun protection. But you're going to see the obvious changes like on your nose and ears and things like that. So, but the hard part is your back because you can't really see your back. Someone has to check you for that. But yes, definitely for that.
And then, how often should I get a full body check by a doctor or a dermatologist?
Once a year, check it. Check your skin. Once a year, if you can go to your primary care physician and they can, once you have your dermatologist, one time they set you up with that dermatologist and you like that person, then you can go back every year. Especially if you have a history of it, you may need to go a little bit sooner, or you have those basal cells, basal skin cells too. And then you may need to go a little bit more frequent. But once a year is about typical for your body check.
Now, is there something I know we touched on a little bit? Because everybody can get skin cancer. It doesn't matter how dark
Mhm.
you are. Um, if I'll use my father as an example. My dad was born in Mexico, and he's like, I don't need sunscreen.
Mm.
I'm that type. He's got Mexican. We don't burn. That's what he always says.
Oh, that's what
Um,
white people say.
um, what would you say to like if so someone like me or someone like anybody listening today if they have somebody in their lives that kind of has that type of verbiage or has those type of like ideas about sunscreen, like what would you recommend the best approach for talking to somebody like that is?
Right. And I would thank you for sharing that because that is the biggest myth buster. I had a woman that said she's Sicilian and Sicilians don't burn. I'm like, yeah, you do because you have skin. No,
Yeah, you just don't see it.
right. So I tell people like I love you wear sunscreen. It happens in the African American population as well. People like, well, I'm 80 years old and I doubt if my mom think about putting on sunscreen. But I tell people now the world has changed, the earth has changed. Ultraviolets are getting closer and closer and closer to earth, so the sun that you had in the 1950s is not the same sun in 2026 just because of climate changes. So we need to protect our skin, and so it can be as simple as like, hey dad or family, I brought you some sunscreen when you're out at the picnic or family gathering, say, hey, what are you wearing? And that's what I do. That's why I got into my Black Girl Magic, because we happened to be at a festival and I started applying it on at the festival. My friend's like, what is that? I'm like, sunscreen. You don't wear sunscreen? I'm like, no, I'm black. I'm like, oh, it doesn't matter. You can still get it. So, or you are still, you know, susceptible to skin cancer. So that's what I would start with the conversation and let them know that the UV rays it's the climate has changed and it's different. I've been to Mexico too, and I feel like it's hotter there than I'm like, my God. I'm like, oh, you really have to put some shade on. Like if you don't want to wear sunscreen, maybe they'll into, which we want them to get that level, but maybe get into the sunscreen clothing or wear a hat, you know, something that makes them look cool and literally and figuratively, right? They can protect themselves with that.
Especially, you know, I bought my dad wears hats now
Oh
because he's
yeah.
bald. He doesn't have any more
Oh,
hair.
he's got to wear a hat now.
So
Yes.
he'll go to, you know, our property out in Michigan and he'll just be red at the top. And I'm like, dude,
Oh,
you should. So now he
yes, you
wears a
gotta
hat
get a
every
hat.
time he goes
That's
out
what you're
there.
gonna buy him for Father's Day, okay, Dakota? You better buy him an SPF hat. Make sure he's cool, complete coverage, or give him a shirt that's SPF too.
And now, it's kind of a good transition because I know that like some people like obviously they like to tan, right? You're saying avoid tanning, UV tanning beds if you can. But for those who like, I mean, I like a good tan in the summer. If somebody wants to tan with the sun, is there a way you recommend to do it safely, or is it just kind of one of those things where just like let it happen naturally? Maybe don't sit out there with one of those big mirror boards like they see in
No,
old
don't
comic
do that.
books.
No, I mean, obviously, American Cancer, we're not going to encourage tanning, but let's
Okay.
be honest. I mean, we ACS have events outdoors a lot in the summertime, our
Yeah.
Relic for Life. So it's hard for us to really avoid it. But I tell people just have your sunscreen on. So you don't want to get sun damage and burn and things like that. You don't want to do that. So just wear your sunscreen and protect yourself and take, like I mentioned in the PowerPoint, take breaks and hang out in the shade once in a while. You don't want to be totally out there in the sun because Lollapalooza's coming here in Chicago, and you know I'm like, oh, these poor people out there wearing sunscreen. But yeah, so there's no shade at Lollapalooza or at a festival sometimes. So I say wear your protective sunwear, or and you'll get some tanning naturally, but please don't go to the tanning bed. Those are just toxic. That's just asking for it. So, but let the nature of the sun get it. And then depending on your skin tone, you'll get some of it. Like for me, I'm a darker skin complexion, so it won't take anything for me to get a tan easily like that.
Yeah.
But for some people, you don't want to burn, like our blondes and our redheads, like I mentioned before. They're very sensitive to the skin, fair skin. Be careful.
Now, how does spray tanning relate to that? Is there like a still a risk of skin cancer with spray tanning, or is that something where you can get like the benefit of a tan without the burn?
Like the spray the tan on. Oh, but that's
Yeah.
different because then you're just getting the coloration from there. But again, we're looking at environmental and the chemicals that you're putting on there to get
Yeah.
the tan out, the spray tan look. You just be mindful of that. I'm not saying that it causes skin cancer, but just be aware and be careful of those spray tans that you use.
Now, in that same breath, in that same conversation, what about tanning oils? Like you're going out there in the sun and you're trying to, you know, real
Oh
bronze
yeah,
up.
no, we won't. ASOS will never encourage you. Like, where's some oils? You
For
tan,
sure.
sir. Because you have to be careful with that too. Because sometimes you can burn yourself with because you want to get the right but some people fall asleep at the beach and then all of a sudden you end up, with a sunburn and it's not good.
And I think you touched on you used like the phrase like a myth or a misconception a couple
Mhm.
times now. What would you say is like the most common myth or misconception outside of the, you know, I'm Mexican, I don't burn, or I'm African American, I don't burn. Like what would be the next most common myth or misconception related to skin cancer?
I think that people don't take skin cancer seriously. They don't, they're like, oh, I don't, we hear about the breast, the colorectal, but we don't take our skin into consideration. And most people don't have a dermatology unless they're treating for acne, but they don't think about, hey, should I be checked for moles? They don't take that in consideration. It's just like, oh, I've always had the mole, unless it's something is painful, or obviously then it will heighten your attention to go to the doctor. But that would be the misconception out of the ones that we mentioned before. But that skin cancer is really not a big deal. And then 5.4 million people nationwide die from melanoma and skin cancer. So it is a big deal.
And now, pardon, you might have answered this too, but when it comes to like moles, do we see
Mhm.
more moles appear as we get older as well?
Yeah, you should. People call the liverworts, like on your on liver spots on your hands or your face. It's just how the skin is aging. And so a lot of that, when we talked to a dermatologist, she said one thing is that people don't protect their skin. You know, they don't wear sunscreen or they too much skin exposure. That can cause, you know, you to have more of these liver spots on your hands. But most of the liver spots happen because of just aging. But if you never protected your skin, then yeah, and depending on the melanin in your skin, you may be more prone to it.
And now, speaking of kind of like aging as it relates to like, skin cancer and getting checked and things like that, is there like a certain age where they recommend you start getting like that yearly dermatologist exam? Like, when should you be going more frequently? Is it just like everybody should do it? Or is it like, when you hit the age of like 35, you should probably go
Um,
more regularly?
you know what? Really, when you think about the children for the age, like your see your pediatrician after well until 18 years of age, so you can see the pediatrician about that for your child. Um, but as far as seeing a dermatologist, it's all going to depend on you. Like if you're the kind of person increasing more basal cells. Sorry, my dog is barking. Oh, we don't hear that.
All good.
And then if not, or you notice some changes in your skin, then that may change the frequency of when you need to see the dermatologist. But there isn't like we must start like for most of the screenings, like you, for instance, breast cancer, we say start at the age of 4. ACS doesn't have like a screening age to start, but it's to start to have that conversation with your doctor. So if you're going for your annual checkups, whether you're 19, 21, you can start asking questions like, hey, I'm thinking about I notice a mole, or when should I go see a dermatologist? Because sometimes people are going to see a dermatologist because their skin problems or acne or something like that. And but then they once they have the dermatologist and they are prescribed or refer to one, then they can go and have their skin checks as well. But not a certain age where we definitely start for skin cancer checks.
Gotcha. And then another one, I think we touched on this a little bit, but are the incidents of skin cancer more common as we get older, like in older adults?
Yes.
Should we? Okay.
Yeah, as we get older, and unfortunately, I just had a birthday last week. So, but as I get older, you're more susceptible to different things because our bodies are making a transition to an older version of ourselves, right? So the things become not as resilient as before. You have that, as one doctor said, that bounce back when you were younger. Thank you, Jess, for a happy belated birthday. So yeah, that's what you definitely want to you want to be mindful of that. So you want to make sure grandma and grandpa, they have if they're not into the sunscreen, give them a sunscreen that they can like, and definitely give them a cute hat. And that helps a lot. Or keep them away from the sun.
Now, the kind of story on my end, when my son was born, he had a very large, like, a birthmark on his
Mm,
foot, and it was like, and then when he was a newborn, and it was like an inch long, and it was like for a newborn foot, an inch is pretty big.
that is
So
pretty big.
it was one of the things that we were worried about when we were seeing his pediatrician, going to visits, and you should be worried about. One doctor told us, oh, we should go see a dermatologist, get checked. Another doctor's like, that's definitely a birthmark. You don't got to worry about any of it. So
Mm.
one of the questions that I have is it is something that we see only due to UV exposure and sun exposure, or is it something where, like, for example, as a new parent, like if I see, a misshapen mole or a birthmark, like, is that cause for concern fresh out the gate?
Yeah, any changes to your body, you check it out. Check it out with your pediatrician. And then two, when you think about like when like for bruises or birthmarks, like we talked about before, like is it changing, is it the diameter, is the color changing? If it's the same color that he had since he was a baby, then that's just his birthmark that he has.
Yep. Same color.
um Same color, so he's good. So we're gonna put sunscreen on that as well. So we're just going to be mindful. I think with skin cancer, the biggest thing is to be aware. I mean, if anything, working at ACS, you're more aware than ever. You like, what's that? I'm coughing too much. Should I get checked out? You start thinking about things like, what's that? Oh, what's that? So
Yes.
you look at yourself, and that's nothing wrong. It's not being hypochondriac or anything, but it's just to be aware of these things. So I'm glad that you noticed things about your son and that you talked about it with your pediatrician, and if the pediatrician said, well, it's fine, it's just a birthmark and it's not changing, it's not rising, it's not getting darker, it's not, then we're good. It's just going to stay and he'll just have that for the rest of his life, but that's fine. And the main thing is be aware of any changes. So that's good that you're aware, you check all the time, you look for things.
No, that's definitely true, and I feel like you said, like working for the American Cancer Society, you start to see things, right?
Mm-hmm.
Like because it's like the same as well. A plumber's going to look for plumbing problems, right, and so on
Right.
and so forth. I mean, when I used to work at a clinic, same thing. Everybody was sick all the time. I was sick all the time. I had a new something all the time. So but that's good. Like some people might call it being paranoid. Other people might call it being diligent. So I definitely have taken away that diligence is more important and always err on the side of caution when it comes to these things because you
Yes,
just don't know, right?
you don't.
I even had I have a birthmark or a mole in my ear, and for the longest
Mm-hmm.
time I was worried it was skin cancer, and I went to the doctor, and the doctor's like, no, you're good, like you're
See,
okay.
so now you see, then that gives you some, May is also mental health month, right? So you don't want to increase your anxiety
Right.
about the unknown. The main thing is like, go check it out, go see what it is. I don't know. Hopefully it's not what you think it is, but it's worth the check.
And that's definitely a good way to kind of segue into like our closing here, because I think that just taking the steps, being educated, and erring on the side of caution, being diligent, and being an advocate for yourself and knowing yourself is
Mhm.
incredibly important when it comes to not only skin cancer but any type of health related
Right.
question or concern that might come up. So, I really want to thank you for your time today, and thank you for, sharing all this amazing information and for being so flexible with our tech issues
No
this morning,
problem.
earlier today. But, I really just want to, again, thank also everybody in the chat, everybody who took the time to be here today, to get this awesome information. And if you have any more questions, you can reach out to the ACS, the QR code is in there. You can go onto their website. And also, if you have any wellness related questions, you can always email us, wellness@transitchicago.com. Then, Michelle, I don't know if you have any closing comments or closing things that you'd like to share with anybody. But other than that, we're done, all wrapped up for today.
Oh yeah, just to remind you all, my little sign behind me, check your risk, know your risk. It's the ACS 360 Cancer Risk. We're very proud of it. It started out a year ago, and it's an opportunity for you, again, not a diagnostic, but for you to check your risk. So you know your risk, check your risk, and then do something about it. This information is private. It doesn't go to your doctor, obviously, but it will help you to partner with your primary care physician to have these conversations. Like, do I need to get that checked out? And I love to go, like you were like, oh, what's that earbud? Like, I love that you did that because that's very important. So we want you to check that, talk about your family history. Like I said, melanomas, a lot of that is related to family history. So we need to know what's in our DNA. And then also what ways that we can do to reduce it. And I'm saying the things that we're doing. Sometimes you say, Michelle, I did everything and I still have it. I'm like, I'm sorry, but at least you did something versus not doing anything. So there are things that you can do. And thank you so much for your time. And I want you all to stay well and have a healthy remaining summer. And please wear your sunscreen or any type of sunscreen wear and be safe out there.
All right, well, awesome, Michelle. Thank you so much, and thank you once again, everybody who joined us today. And I hope you have a wonderful rest of your day and week.
Thank you. Bye.
Take care, everyone.